Hi everyone, I'm Jennifer Jackson and I'm a registered nurse. Today I was doing some online work for COVID-19 that required looking a little bit smarter than usual. So I had a shirt with buttons on and a full face of makeup, and those are things you don't waste when most of the time these days we could be in our pajamas. So I thought I would take a few minutes and record a video about a Gibbs Cycle workshop that I created with colleagues at King's College London. And so we're going to go through what the Gibbs cycle is and how you can use it in reflections, whether you are a nursing student, a midwifery student, or working in another discipline. Gibbs is a nice framework to use for writing reflections, and we'll talk through how it can benefit you in your practice. So, just switching over to the slides here. All right, so this presentation was initially designed as a workshop. So there's a few elements in it that do work better as a workshop, but what I'm hoping to do is that by providing you the resources, perhaps you can use it in an adapted way that will suit your learning. So what I asked participants to do at the beginning of the workshop was talk about an example where they had felt proud of being a nursing student, a midwifery student, or you can think of just a time when you felt proud of something you'd done in your life. And so we used this guideline in a handout to interview each other. And so what people would do is interview back and forth. Tell me about what happened. What did you do? Why did this experience stand out? And so by asking questions back and forth, it becomes a very natural type of sharing of a story. Whereas I find sometimes when students look at stages of the Gibbs cycle, they get a little bit paralyzed because it's like, well, I have to mash my experience into these boxes and make it fit and say the right things. And that isn't what we're trying to do here. If we think of working in healthcare as both an art and a science, this has more of a flavor of the art. So what we want to do is think about how can you narrate through a story, and how can you use that to explore your own experiences, and also to for the purpose of assignments, to reflect those experiences clearly for the person who will be grading it. So I'll get into more detail now, talking about what is the Gibbs reflective cycle and why do we use it? Why do we have to do this in the first place? So when we think about working in healthcare, it is a professional obligation to reflect on your work. So reflecting on your work is ethically and morally required of all nurses, midwives, and other people who work in healthcare. And it's built into our codes of ethics. So it is required by the Nursing and Midwifery Council or by the Canadian Nurses Association, but it's also something that benefits you. So one of the really powerful ways we can learn is by reflecting on our experience, seeing what we would do differently or what went really well that we can do again, and then how we can translate that to a future example. And so why we use the Gibbs cycle is to create some structure as we reflect on our experiences. This is a way to organize your thoughts. And we use lots of different tools for organizing our thoughts. For example, if we're giving a handover and we use an SBAR tool, so situation, background, assessment, recommendations, or you use any type of way of organizing your writing, your assignments, the way you communicate with your colleagues. The Gibbs cycle is another way of structuring personal debriefing. So it's not a set of rules, it's not a fill in the blank sheet. It's designed there to provide some structure so that you organize your thoughts. Gibbs is also good because it matches looking backwards with looking forwards. So you want to be able to reflect on your experiences, but also say, how am I going to use this in the future, and how will this benefit my future practice? So one other reason why we use the Gibbs cycle is that reflection is essential in managing your emotions. So a lot of my research has been on resilience in people and systems, and I have seen that managing your emotions is incredibly important. So what I mean by managing is not hiding, suppressing, anything like that, but we have to deal with difficult emotions like guilt, shame, sadness, fear. We have to manage those in a constructive way and not become paralyzed by them. And so what the Gibbs cycle helps us to do is move through a process. So rather than getting stuck and thinking about what you did wrong or what went wrong or how someone yelled at you, instead of thinking about that over and over and over and over again, what this helps us do is move through a process and move beyond what actually happened and look at the bigger picture. So it can help you to understand in different situations, whether they be good ones or bad ones, kind of what was going on and how can you use that in the future. It also helps us bridge from these are things that we learned in our classes, but then this is what I saw in the clinical setting, and how are those two things different if they are different, and why are they different, and what does that difference mean? So this is a way to provide structure to taking care of yourself, essentially. Emotional health and well-being is essential for anyone who works in healthcare. It's essential for all of us to function well, but especially for people who work in healthcare, because we are with people at their most vulnerable and at life-changing moments. And put on your own oxygen mask before assisting others. We need to take care of ourselves so that we can take good care of our patients or work effectively with our service users. And this is part of it. So how does reflecting help? Well, through many of my clinical experiences, I find it's really easy to get stuck. And you can get stuck on thinking over and over again about what happened and reliving the feelings associated with what happened. And we want to use reflection not as a chance to repeatedly shame yourself or repeatedly gloat about what happened. What we want to do is use reflection to build practice and build our personal process of resilience. And so this reflecting is really important. There's lots of ways you can reflect, but we're trying to use Gibbs because it helps create like a healthy forward-looking path for reflection. Because working in healthcare is, as these images show, is a very windy road, and we don't want anyone to suffer consequences of experiencing difficult things and not being able to work through that process. This isn't to say that you have to manage these emotions individually. Using the Gibbs cycle is one tool of many, and this doesn't replace speaking with mentors, colleagues, professional counseling, or anything like that. But this is one tool that we use in a complement of things to help promote reflection. So looking more specifically at how the Gibbs cycle works and how you would use this for assignments. So the Gibbs cycle focuses on moving from description, so talking about what happened, what were you feeling, what was good or bad about this, what sense can we make of the situation? And I think when we're thinking of analysis, another way to think of that is like, what is really happening here? What else could have been done? And what would we do again if this situation comes up, or a similar interaction comes up, and how can we take that forward? So back to the idea of working through questions, we can think about factors at each level of this analysis. Now, one of the things I cannot stress enough, this is, asterisks here, this is the most important thing I have to tell you about assignments pertaining to the Gibbs cycle. This assignment is about you. This assignment is not about the patient or about the service user. This assignment is about you. So the biggest mistake people make is they write them up like case studies, and they provide loads of information about the patient and what was happening with the patient and who the matron was or who was in charge that day and why it happened the way it did. And that is all very important, but it is not required in this context. So I don't care a great deal in this specific context about what was happening with the patient. I care about you. And so when you are doing this assignment or any type of reflective assignment, this is not about the patient. This is the most important thing I can say. So we're very used to writing assignments that are about patients, about cases, about populations, about other people, but this is about us. So we need to write about ourselves. So when we're looking at the different stages of the cycle, we want to think about how we are writing about ourselves. So often what students will do, if you have an assignment like this and it's 1,500 words, you start a description, and by the time you're done telling us about the patient, about what happened, we are already into 700 words and you haven't even started talking about the other elements yet. And the other elements, this relates closely to the idea of Bloom's taxonomy, which I go into in more detail in my video about writing. But we need to focus on the points where you show evaluation, analysis, conclusion, action plans. That is where you demonstrate your critical thinking and your higher level skills. So if you put the word count emphasis all on description or all on explaining how you felt about this, you're not going to do well on the assignment. And that doesn't mean the things you write aren't valid. It means that you did not meet the objective of what this is trying to do, which is foster constructive reflection for yourself. So if we think about an example to go through, perhaps I can think of an example where at work a patient yelled at me and I went into the sluice and cried about it, but then what can I do from there? So that synopsis I gave is really all you need to say. In description, I could say, a patient yelled at me. That is it. I don't need to know who the patient was or what was wrong with them or anything that's going on. The patient yelled at me. Done. So I could say something like, the patient yelled at me. That made me feel very upset. I responded by crying, running away. This was really, really difficult for me because I felt like a failure as a nurse. So then we can move to evaluation and talk about, this is why it was difficult, is because nursing is part of my identity. Nursing is not something I do, it's something I am. And for somebody to scream at me that I'm a bad nurse is like it felt like a very personal attack. And you could start to unpack that a little bit more. When you come to the analysis stage, you can say, what was actually happening here? This is a great point to stand back and say, what was really going on? So in that particular case, I could say, you know what, this person did yell at me and that was not appropriate, but they were experiencing a life-changing diagnosis. They felt powerless, they were out of control, they were possibly also withdrawing from nicotine or alcohol or any number of things. They were in a strange environment where all their control had been taken away from them, possibly their dignity, if they feel like they're just stuck in a blue gown and helpless in bed. This person might not understand what's happening. This is a very foreign environment. And then all of a sudden I come along and say, no, you can't watch TV right now because you have to go for a test. And the person exploded. And so what it was about was not me as an individual. It was about someone who was overwhelmed, and this was the last straw. So then when you come to conclusions, you can say people in health who are experiencing, say, inpatient healthcare are very vulnerable. And what I've learned from this is that it's not about me as a person, and that I am also more than a nurse. And being criticized for my nursing is not a criticism of who I am as a person. So what I'm going to do differently next time is, still be upset, because this is an upsetting thing. It's not saying I'm never going to cry again at work. It's saying I'm going to make sure that that person knows that I am still there to provide care for them and engage in a therapeutic relationship, and that I know that this kind of thing is not necessarily about me, which will give me more emotional control in that moment. Okay? So to me, that would be a quick example of how you can use the Gibbs cycle to explain a situation. Very little emphasis on the description and the feelings, lots of word count devoted to evaluation, analysis, conclusion, and your action plan. And you're writing about yourself with very minimal involvement of the other people that were part of that example. Okay? So, reiterating what I've talked about, if we think about 1,000-word reflection, how do we want to divide that up? So if we're thinking about 1,000 words and our cycle has these stages, description, you probably want 50 words. A patient yelled at me. 5. So you want to keep the description as minimal as possible. So absolutely no more than 10% of your word count. So in this case, 100 words. If we're thinking about feelings, again, same thing, 100 words. That gives us 800 words for the rest of the assignment, and you could divide, do 200 each. You could also put 250 and do 150 or 100 in other places. You can gauge how you judge that. But the most important thing is that the beginning is a quick introduction and you get to the evaluation much more quickly. You also want to, you can make an outline and say, how can I write about each of these things, and put the word count beside the outline so that when you see the word description, you see 100 words beside it. You can save a document like that and have it a template every time you need to do one of these, so you're never starting with a blank piece of paper or a blank document when you're working. And then you can say, okay, description 100 words, and then keep an eye on that 100 words, because if you were writing and you end up writing a description that's 250, it's a good flag to say, whoa, I need to stop, something's not working here. This also helps you break your assignment into pieces for planning. So if you say, oh my gosh, I have to sit down and write the entire thing today, and this was a really stressful experience that I have to kind of get into, and I don't want to do that. That could be a really difficult thing to manage. And so what I suggest you can do instead is say, okay, the assignment's due Friday, it's Monday. Today, I'm gonna write descriptions and feeling. Tuesday, evaluation analysis. Wednesday, conclusion and action plans. Thursday, take the day off, don't look at it. Friday, read it over, submit. Or, you can use a workflow that works for you, but you can have these different stages by breaking them into pieces. Then it can help manage your planning for your assignments and your workload. And so the assignment goes from being this big, horrible thing you have to write down to, I'm going to write under 100 words of description. Even if it's not a great day, I can probably do that. And if that's all you get done, that's a concrete step forward. That's part of your plan, and then you can move on from there. So, and this can also be something, you discuss with your mentors or your tutors, whomever you're working with, on a case-by-case basis, and say if they want emphasis in a particular place. But the general principle applies, that don't focus on the description and write about yourself. So overall, we want to understand our experiences and look both backwards and forwards. You also want to reflect throughout your career. So you won't be doing Gibbs cycle assignments when you're 5, 10, 20 years after graduation, but at the same time, this process, we're hoping to help you build it now and get it started, because it's something you will use your whole life. So I hope that you have a wonderful, long, satisfying career in nursing, and I wish you all the best. I think we will bring it to an end there, but if you have any questions, feel free to ask in the comments, or on Twitter, I'm at jjackson_RN. And if we need any clarification, I'm happy to make a follow-up video and go from there. All right, thank you very much. Best of luck. Happy nursing, happy midwifery, and take care of yourselves.